So Dr. Crespo, thank you so much for joining us. As you know, this is our 5th Drive for Men's Health, and I'm excited to have you discuss with us what you do, and which is infectious diseases. Well, what exactly is that?
So infectious disease is a very broad term. We basically deal with infections of any kind. It could be viral infections like the flu or common colds or HIV or mono, bacterial infections, which include STDs, which are very important. Some of them, some parasitic infections. So it's a very broad spectrum. We are very busy in general.
Yeah, so a lot of the stuff we see come in the news every couple of years is about infections guys get at the gym. And then people get really scared and they stop working out and use that as an excuse. Like, how legit is some of that stuff?
So what you can get at the gym, one of the ones that we always check is MRSA, staph infections. That could be contagious by contact. Let's say somebody uses a machine in the gym and has MRSA on their body. They sweat. They don't clean the equipment after using it. Then somebody else comes and uses the same machine. It could get the infection like staph infection. So that's a common one. Of course, other diseases that could be transmitted by, like the flu, for example, could also be caught in a closed setting. But those are some of the concerns when you go to the gym.
But most of the time, it's okay. So don't use getting something rare like this as an excuse not to go.
Absolutely. I mean, it's not an excuse not to go, and you can always clean the machine, which is what is recommended.
Yeah. So those little wipes that you see,
yeah,
go ahead and use them, and don't trust that
for.
someone else has done it afterwards.
That's what it's for, yeah.
So STDs, sexually transmitted diseases, we hear a lot about that, and I think the problem with men is that they often ignore it and want to kind of get the excitement of that night out. But the reality is this stuff is pretty dangerous. So what would you say to men out there? Like, what are some of the crazy things that you've seen that they should, kind of think twice before not protecting themselves?
Sure, definitely they happen, and they happen more often than people think. That's what we always advise to use protection. Think about that. Take the precaution that everybody knows what they have to do.
Yeah.
So.
And what is that for someone that may act like they don't know what they have to do?
You use condoms, pretty much. That's the main, the best way to protect for most, the STDs. I think that if you use condoms, you're going to be safe.
Yeah. So if a guy has not used a condom, starts having some discharge, what are the next steps that they should take?
So then they need to look for advice. You need to be tested. Look for go to your primary care physician or an urgent care center or emergency room. You have to be tested. It could be a sexually transmitted disease like gonorrhea or chlamydia, and there are some other out there that can be present, but you have to be tested and be treated properly. Not only for your own health, also because you can transmit that to your partner.
Now, I've heard that you should also get tested if you have high-risk behaviors, regardless whether you have symptoms or not. Is that true?
Yes, I think people with high-risk behaviors, like doing unprotected sex, they should be tested even if they don't have symptoms. Yeah.
Mm-hmm. Now, when should that testing start? On average, we would say.
You mean like age? When people become sexually active, I think you need to start being concerned about that.
Mm-hmm. Now, there are certain STDs that even with condoms can still be spread. I like the herpes, and they can be spread by some other ways as well. Do you mind kind of expanding on that a little bit?
Correct. Herpes is a little tricky because even if you don't have lesions at that moment, at the moment of intercourse, still there is a potential of transmission, and that's what makes it more difficult to predict. I think that, but it still is recommended to use condoms, and that minimizes the risk, even if it's not 100%.
Yeah, and I think for herpes, is it that there's a vaccine now that guys can get?
It is. There is in development, but I don't think that is out there.
But there is a vaccine. What's it for?
For varicella zoster, for shingles.
Okay. So in terms of infectious diseases, HIV is always something that's very prominent out there. Are there any new treatments out there for it that makes it a little easier if you have contracted HIV?
Yes, HIV is interesting. It's been with us for a while, since the 1980s. We've made a lot of progress in the management of HIV, which has basically transformed HIV into a chronic disease, which is a good thing in the sense that somebody that is diagnosed with HIV nowadays, probably can be treated very easily with one pill once a day and can live a normal life like anybody else and live as long as anybody else. So that's a very good thing. One of the downsides is that people tend to be less afraid of HIV, and people tend to be more relaxed, and especially I see that with the younger generation that didn't live through the 80s and 90s, the nightmare of friends, family, people, famous people and people that they knew that died from HIV. So I think that has that's a counter effect that we need to keep in mind. But in general, we have made a lot of progress. We have very good treatment, very effective. Patients can be undetectable, which is the goal, very quickly after we start treatment. So a lot of progress has been made in the management of HIV.
Now, a lot of these diseases, your body overall can fight if it's stronger. So what can guys do out there to kind of pump up their immune system to avoid getting if they get infectious diseases, if you're stronger and healthier, I'm assuming that you'll be able to fight it much better than if you're not, if you're immunocompromised.
That is true. I think the most important is to have a healthy lifestyle, eat healthy, exercise. I think the more healthy that you are overall, you're going to be in a better shape to fight all of these infections.
Yeah. Now, you mentioned you're a chief quality officer. So what does that entail?
So chief quality officer here in Dr. P. Phillips Hospital is another exciting part of my life.
Yeah.
I work, the idea is to improve quality and safety in the hospital. So part of that has to do with infections that can be acquired in the hospital. We talk about staph infections like MRSA, infections like C. diff, which
urinary tract infections.
Well, infections transmitted by catheter, like the ones that you like to place on patients.
Oh, just blame us.
We have to be sure that they don't stay there enough for patients to get infections. That goes, quality goes all the way to preventing falls, preventing pressure ulcers. We're also working a lot in improving patient experience in the hospital, improving the patient throughput through the hospital. So we do a lot of things.
You do a lot of things, and one thing you tell me to do all the time, which can get very annoying, is wash my hands.
Wash your hands.
But that's very important.
It is very important. It takes 20 seconds to do a good hand hygiene, and it prevents a lot of infections.
So is it better to actually wash your hands, or can you just use the little soap things or the pumps?
You can use the alcohol foam in most of the situations, except if, for example, in patients with C. diff, you have to use soap and water, because otherwise you won't remove the spores, which is the problem in those cases from the skin.
And I've seen a lot of guys when I'm out in the bathrooms, not in the hospital, but elsewhere, where they sometimes won't just wash their hands, or they'll just wash it for like 1 or 2 seconds. I think that's kind of weird. Like, I wish they had the same posters we have here in the hospital at all general facilities where bathrooms are, so people can actually learn how to actually wash their hands.
I agree. I think it should be the same way whether you are in the hospital or outside in the soccer game.
Yeah, so standard precautions here. So 3 tips that guys can take away right now on how to live a much healthier lifestyle, because it may take time for them to get to see their primary care doctors or engage with a healthcare professional. What can they learn or start doing today to improve their lives?
I think that we talk about STDs. I think that you have to take that seriously. You need to prevent them, think about them. Use condoms, use protection when you are in a situation that you know that you have to do it.
Yeah.
I think that if you develop symptoms that could be suspicious for an STD, look for help right away, because it's not only for your own health but also to prevent transmission to other people. The other one that we didn't talk about much was about hepatitis C. Hepatitis C is very prevalent, very common. A lot of men has hepatitis C,
and how would someone get hepatitis C?
Hepatitis C is transmitted by contact with blood from somebody that contaminated blood with somebody that has hepatitis C. So in the past, blood transfusion was a big problem. Patients that use IV drugs and they share
I want to
needles.
stress in the past. So blood transfusions are fine now. I mean,
now they're very safe.
Yeah.
But in the 70s, in the 80s, in the 90s, before hepatitis C was recognized, a lot of people unfortunately acquired the infection through blood transfusions. Right now, the main is IV drug use. We're still seeing a lot. It's an increasing problem in our society. So that's obviously a risk factor. But in general, anybody that is on the baby boomer age should be tested for hepatitis C.
Really? So
yeah,
you should?
That's a group, the highest risk group at this point, because and not necessarily because of using IV drugs. Some people, we cannot identify any specific risk factors. And they still test positive. The good news about hepatitis C is that there is an excellent treatment nowadays. We have very, very potent drugs that work very well, and basically we're able to cure more than 90%, 95% of the patients with 3 months of treatment.
And how hard is the screening for it?
It's just a single blood test.
So it's easy?
Single blood test, yeah.
But you wouldn't know until you actually go and see your doctor and get that roadmap to see whether you should be screened or not. So it's very important to go and see your physician, engage a healthcare professional. It's also important, generally beyond that, to live a healthy, active lifestyle. So Dr. Crespo, thank you so much for sitting down with us today. Matt, did you wash your hands?
Yeah.
Okay, all right.
My name is Dr. Antonio Crespo, and it's time to drive for men's health.